Rheumatoid arthritis. Rheumatoid arthritis is a chronic autoimmune disease. Autoimmune disease means that the body's immune system attacks its own healthy cells. Currently affects over 1.5 million people worldwide. While RA can be diagnosed at any age, it is usually diagnosed between ages 40 to 60. This disease not only attacks the joints, but can affect almost every area of the body. There is currently no known cause of RA. However, there are several factors that doctors believe contribute to RA. The first factor is genetic. People with a specific gene, human leukocyte antigen, HLA for short, are 5 times more likely to be diagnosed with RA, though not everyone with RA has this gene, and not everyone with this gene has RA. Environmental factors are another potential cause of RA. These can include bacteria and viruses, secondhand smoke, air pollution, and insecticides. There are also occupational hazards, which can include exposure to mineral oils and silica materials. The final contributing factor is personal. Up to 70% of people diagnosed with RA are women. Also, those that have a family history of RA are more likely to be diagnosed. RA is a disease of the joints. In the body, the bones are covered by a tough, elastic tissue called cartilage. Inside the joints is a joint capsule, which is lined with a tissue called synovium. In a patient with RA, this area is infiltrated with inflammatory cells, including T cells, B cells, lymphocytes, macrophages, mast cells, and mononuclear cells. When this area becomes inflamed, it begins to invade and damage the cartilage and bone of the joint. This disease often affects smaller joints of the body, such as the hands, feet, wrists, elbows, knees, and ankles. This slide shows a normal joint and a joint affected by rheumatoid arthritis. Notice the swollen joint capsule and the inflamed synovium. Blood is one of the tissues affected by RA. Anemia is very common in patients with RA. Anemia is an abnormally low number of red blood cells that are low in hemoglobin. Phelps syndrome is also a condition that affects some with RA. This condition affects the white blood cells and can sometimes enlarge the spleen. Skin is another tissue affected by RA. One common skin condition is rheumatoid nodules. These nodules are lumps of tissue that form under the skin, usually in areas exposed to pressure. These nodules aren't typically painful. Another tissue complication is rashes or skin ulcers. Inflammation of the blood vessels are also common in patients with RA. This can affect any organ, but is most common in the skin. RA-related inflammation can cause issues in many organs of the body. One of these organs is the heart. The inflammation can weaken the heart muscle, valves, and blood vessels. Heart attacks are more frequent in patients with RA. It is also not uncommon for patients with RA to develop pericardial effusion, which is a collection of fluid around the heart. Lungs are also affected by RA. Rheumatoid nodules and lung infections are more prevalent in those diagnosed with RA. The eyes are another organ that is affected by RA. The inflammation of the tear glands can cause the eyes to become dry and inflamed. It can also cause scleritis, which is an inflammation of the white of the eyes. There are many organ systems affected by RA. The nervous system is affected because the deformity and damage to the joint can cause entrapment of the nerves. This can cause severe damage. Carpal tunnel syndrome is very common in patients with RA. The musculoskeletal system is also affected by RA. Damage to the surrounding muscles and not using them can cause the muscles to atrophy. Another effect of RA is the damage to the bones and joints can cause deformities, making it difficult to move the affected areas. Osteoporosis is also common in those with RA. This is a loss of bone density due to chronic inflammation. This slide shows the damage rheumatoid arthritis can do to the hand. In RA, patients will go through flares, which is an increase in inflammation and other symptoms. These flares can last for days or months. There are a few key signs that are present in those with RA. These include joint pain, warmness of the joint, swelling, and stiffness that lasts longer than 6 weeks. The stiffness is often worse in the morning, lasting 30 minutes or longer, and will typically improve as the day progresses. This disease typically appears in multiple joints, usually in the same joint on both sides of the body. Some additional symptoms of RA are fatigue, loss of appetite, low-grade fever, weight loss, and weakness or loss of energy. While there is currently no way to prevent RA, it is very important for it to be diagnosed early and treated aggressively. There are several non-drug approaches to treatment. One approach is through therapy. Some therapies recommended are physical therapy, hydrotherapy, relaxation therapy, and occupational therapy. Another way to help prevent the symptoms of RA is through diet and exercise. Some believe that food allergies play a role in inflammation, so they will change their diet to avoid those foods. Another less common option is surgery. One type of surgery is a synovectomy, which is the removal of the damaged synovium. Some other surgical options include tendon repairs, replacement of badly damaged joints, and the fusion of joints. Any of these procedures can be done to help alleviate pain and improve function. Another important way to treat RA is through medication. Most of these medications will slow down the progression of the disease. The first type of medications used is non-steroidal anti-inflammatory drugs, NSAIDs for short. While these medications don't slow down the progression, they do treat the inflammatory symptoms. These medications include ibuprofen, naproxen, and Celebrex. Another type of medication used is corticosteroids. These potent and quick-acting medications are meant to be used for only a short amount of time and in low doses. These drugs include prednisone and methylprednisolone. Disease-modifying anti-rheumatic drugs, DMARDs, work to interrupt the course of the disease. These include methotrexate, hydroxychloroquine, and leflunomide. A subset of DMARDs are biologics. These medications typically work when others don't and can slow, modify, or stop the progression of RA. Humira and Enbrel are two of these medications. A new type of medication is a JAK inhibitor. This type of medication blocks the Janus kinase pathways, which are involved in the body's immune response. A type of JAK inhibitor is tolfactinib. There can be many consequences of having RA. This disease can limit the range of motion in the affected joints, which can restrict the mobility a patient has. Another consequence is the amount of pain a patient will experience. This pain can affect a patient's ability to do basic tasks, such as turning a doorknob and picking up objects. This disease isn't considered fatal, but the complications can shorten a patient's life. Some of these complications include an increase of infections, lung disease, heart disease, lymphoma, and fibromyalgia. Rheumatoid arthritis is a very complicated autoimmune disease. It can affect all areas of the body. By getting an early diagnosis and treating it aggressively, we might be able to slow down the progression of this disease. Researchers are constantly working on new treatment options, and one day we'll hopefully find a way to cure or prevent this disease.